The therapy I chose to research is PROMPT, which stands for Prompts for Restructuring Oral Muscular Phonetic Targets. It is a tactile kinesthetic-based treatment which can benefit individuals with motor speech disorders. This article, treating speech subsystems in childhood apraxia of speech with tactual input, the PROMPT approach by Dale and Hayden, specifically looks at the benefits that PROMPT therapy can supply to patients with childhood apraxia of speech. This is interesting to me because I did not know that tactile cues could be used to help individuals speak. The researchers hypothesized that the use of tactile kinesthetic proprioceptive cues, also known as TKP cues, support and shape the movements of the oral articulators. The study followed 4 children between the ages of 3 and 6 who had been diagnosed with childhood apraxia of speech. They were divided into pairs at random, and each received a diagnostic procedure of targeted phonemes. After the diagnostic procedure, they went into 2 4-week-long treatments using PROMPT. During the first 4 weeks, one group received full PROMPT treatment while the other received the treatment without TKP cues. Then during the second 4 weeks, the participants received full PROMPT treatments 2 times a week. Speech production was measured by standardized tests. The targets they looked for are word and phrase intelligibility, articulation, gross and fine motor movement, speech movements, and sequencing in connected speech. Their goal was to study the effectiveness of 16 sessions of full PROMPT treatment versus 8 sessions of full PROMPT treatment and 8 sessions of PROMPT without TKP cues. What they found was that all 4 participants improved significantly with treatment. However, those who received 8 weeks of full PROMPT treatment therapy made more motor speech control gains. The main strength of this experiment was that it studied multiple speech production aspects. This allowed for more broad and accurate representation of progress as a result of the therapy. A limitation of the study was the small amount of baseline sessions. The researchers only had 3 baseline sessions with each child, however 5 is usually suggested. They did acknowledge this, but reported that this was due to a time constraint. They had worked with the children over summer break so that school-provided therapy did not interfere with the study. The researchers noted that more definitive evaluation will require a larger number of children in a longer period of treatment. This is backed up by the children's improvement in scores, specifically in intelligibility, targeted motor movements, and coordinative actions in not only words but short phrases as well. The data shows scores from pre-test, midpoints, post-test, and follow-ups. Each child improved in each standardized test. However, the children who received TKP cues improved more so than those who did not in many of the tests. I would like to know if the results are similar with adult patients.